Hi, my name is Jamie, and this is my story. During my junior year of college, I was hit from behind during basketball practice, and my head bounced off the court. I was scared to report it at first, but reported it the next day to my athletic trainer. I thought it was just another injury. I've had concussions before. I'll rest and I'll be back. After a couple of weeks, I noticed I wasn't getting better. I still had headaches, noise and light sensitivity, irritability, and everything around me just felt like it was slowed down. My parents talked to me about quitting sports, but I still wanted to play. 3 weeks after my concussion, I was on the road with my basketball team, and I blacked out. After talking to my athletic trainer, she told me, "You can live without an ankle if you play with a sprain, but you can't live without your brain." After Christmas break, I was no longer an athlete, but I was still a student, and when I returned to school, I just couldn't do it. It was impossible, and my doctors agreed. I can't drive, can't go to movies, can't hang out in busy places with my friends. Everything I used to do, it now makes me sick. And I can't help but think, where will I be in 10 or 20 years? Will I be stuck like this forever? I get frustrated when I know that I can do something before, but I can't do it now. Growing up as an athlete, I wish I'd known the seriousness of concussions and how it could impact my life.
Well, Jamie's been very active in sports since she was 5, 6 years old, with the ASO sports, softball, basketball, and I believe it's four concussions. Obviously, this last one was the most damaging and traumatic. I wish I knew more about concussions at an earlier time to maybe prevent this from happening to her.
Did all of Jamie's concussions look the same, or?
I think overall, every concussion had a different level of severity. This last one, I actually found her sleeping in her car, slumped over a steering wheel at 2 in the morning. I thought, maybe she was just tired, but finding out that she had a concussion, looking at her eyes, she was really affected with the fourth one, the most.
Were you aware of how serious concussions were before Jamie experienced hers?
I had a little insight, but not to the extent of what I know now. I mean, it's a whole lot of complexities that is going on with Jamie, and so to answer your question, no.
What do you think the biggest thing that you've learned from how serious and how much impact concussions can have on an athlete?
It can definitely impact the whole family cohesiveness and put a lot of stress on everything. For me, at times it's very hard to even concentrate at work thinking of Jamie. Even for my wife, what she's going through. Our son, is jumping in now to help care for Jamie when he has time. We thought she was going to have a cardiac arrest at one time, so we had her checked out. So there are a lot of things going on with her unsteady eyes, her balance, her motion, exertion, not being able to ride a stationary bike for more than 3 minutes was really concerning to me. From running up and down a basketball court for an hour non-stop to not being able to ride a stationary bike for more than 3 minutes was heartbreaking.
Repeated traumatic brain injury is a major health concern. Far and away, the biggest risk for traumatic brain injury is in a patient who has suffered a prior traumatic brain injury. That is to say, those individuals who have had one injury are susceptible to having another.
Some of the common symptoms of traumatic brain injury, which put a person at risk for acquiring additional injuries to the head, include fatigue, headache, dizziness, vertigo, changes in reaction time, balance or coordination, loss of attention, impaired judgment, impulsivity, and aggressiveness.
Brain injury will heal to a certain point, and if that patient makes a complete recovery, a second injury may not necessarily portend a worse outcome. We do know, however, in watching patients, for instance, over long periods of time in professional football and other sports, that if somebody has not recovered from a traumatic brain injury, has a second and a third insult, that they will never usually get back to their baseline. If we've not recovered from our first brain injury and then have a second injury, the effects are more than cumulative. They become greater to recover from.